A federal judge recently ruled that the government must make the most common morning after pill available over the counter for all ages, ending the mandate of a prescription for girls 16 and younger. There are legitimate concerns with this, and one of those concerns is that we simply don't know the long-term effects of this medication.
Yeah, and I would agree. I mean, we know that levonorgestrel in general has increased side effects, risk of blood clotting, and so that's one effect. And we also are concerned about progestins on, our cardiovascular panels, on breast health, breast tissue, and one use, maybe once a month, may be safe or effective, but is, more frequent use going to be safe and effective. But the goal for emergency contraception, I 100% believe, is that, in the proper context, that it can reduce the unintended pregnancy rate from 8% to 1%. There's still a percentage, but is it safe? Are we risking our kids, our younger kids, to the issue of, continued peer pressure, continued coercion? Is it something that, girl or boy is going to buy and have their partner take? And so my concern is really where are we inspiring preservation of self, health, concern, and their own individual rights to be really well educated on the side effects, the benefits, the way it should be intended to be used.
If a girl gets raped or has a condom break on a Friday or Saturday night, and she has to go through the barrier of having to make an appointment with her doctor, go in, have a medical screening, get the prescription, go back to the pharmacy. I mean, maybe the pharmacy's closed on the Sunday, and it's like, you need to take this within a day or 2 days in order for it to work. And so that's prohibitive. If she gets up on Sunday morning and can't just go to the pharmacy and buy this like she would buy Tylenol, she has to wait till Monday for the medical appointment. It's a significant and prohibitive barrier to getting emergency contraception.
If a person really wants to do some damage to their body, go take 12 Tylenol. That'll do some damage to you. I mean, let's just be real, open about this. An 11-year-old girl, if she wants to do something really bad, the number one killer of people in America overdosing now is Tylenol. So you can go buy that all day, every day, and take 3,000 pills if you want to. If we don't allow access, we start allowing problems.
Well, I think, may I speak? I really believe that allowing access without education is not decreasing the problems. In fact, we may be increasing it, because what message are we sending to these young girls? And I'm a mother of 5, right? And I'm an OBGYN that trained at Emory University and worked in Grady Hospital. I've done rape exams on 2 years old, 7 years old, 9 years old, and delivered 11-year-old babies. Okay, so I know the devastating consequence that this can have, that, unprotected sex, and for an 11-year-old can have in having a pregnancy and having a delivery. I've also delivered 21 years olds, their 5th babies. So having access and having this available doesn't change the amount of unintended pregnancies there are. Show me the research that shows this. We're scientists, doctor. Show me the research that shows this is going to decrease unintended pregnancy. It's going to decrease.
Dr. Herbert, I'll make sure you get your time. Let's just make sure that Dr. Cabeca gets to finish her thought.
I'm a researcher at heart, right? I'd love to see the research that says this is going to be safe and effective. And then I'm in 100% that it's going to establish a sense of self-confidence and voice. But the 11-year-olds, 12-year-olds, 13-year-olds that I've seen in my practice as a gynecologist and an obstetrician over the past 20 years has shown me that they lack self-confidence, that they are very frequently peer pressured and influenced by partners. Date rape is not uncommon. Having your boyfriend give you the emergency contraception is not instilling confidence in these women. So educated use of these products doesn't prevent anything, does it? And where is it helping? Where is it building the sexual voice of these young teens? I highly educate girls in this area, and it needs to be part of giving that plan B, that voice of education, the role of condoms, whatever you need to add to that plan B prescription has to be part of the package. In and of itself, it's not safe. Just like in and of itself, overdose of Tylenol is not safe. So making it acceptable like Tylenol does not seem like we're really giving a health message that's powerful, that's going to empower our next generation of women, mothers, leaders in our community.